Hello everyone, I hope you are doing well. Today I'm going to discuss about agonist and antagonist. What are agonists? These are the agents that bind to receptor and produces a biologic response. An agonist may mimic the response of the endogenous ligand on the receptor, or it may produce a different response from the receptor and its transduction mechanism. Now, what are its type? It has three different types. These are full agonist, partial agonist, and inverse agonist. What are full agonists? If a drug binds to a receptor and produces a maximal biologic response that mimics the response to the endogenous ligand, is known as full agonist. If I describe in another definition, it's a drug that binds to a receptor, stabilizing the receptor in its active conformational state. For example, phenylephrine is an agonist at alpha 1 adrenoceptors because it produces effects that resemble the action of the endogenous ligand, that is norepinephrine. Upon binding to alpha 1 adrenoceptor on the membranes of the vascular smooth muscles, phenylephrine stabilizes the receptor in its active state. This leads to the mobilization of intracellular calcium ions, causing interaction of smooth muscles, actin, and myosin filaments. The shortening of the smooth muscle cells decreases the diameter of the arteriole, causing an increase in the resistance to the flow of the blood through the vessels. Blood pressure therefore rises to maintain the blood flow. As this brief description illustrates, an agonist may have many effects that can be measured, including actions on the intracellular molecule cells, tissues, and intact organisms. All of these actions are attributable to interaction of the drug molecule with the receptor molecule. In general, a full agonist has a strong affinity for its receptor and good efficacy. Now I'll move towards its second type, that is partial agonist. Partial agonists have efficacy greater than 0 but less than that of full agonist. Even if all the receptors are occupied, partial agonists cannot produce an Emax of as great a magnitude as that of full agonist. However, a partial agonist may have an affinity that is greater than, less than, or equivalent to that of a full agonist. A unique feature of these drugs is that under appropriate conditions, a partial agonist may act as an antagonist of a full agonist. Consider what would happen to the Emax of the receptor saturated with an agonist in the presence of increasing concentration of a partial agonist. As the number of receptors occupied by the partial agonist increases, the Emax would decrease until it reaches the Emax of the partial agonist. The potential of partial agonist to act both as an agonist and antagonist may be therapeutically exploited. How, for example, aripiprazole and a typical neuroleptic agent is a partial agonist at selected dopamine receptors. Dopaminergic pathways that were overactive tend to be inhibited by the partial agonist, whereas pathways that were underactive may be stimulated. This might explain the ability of aripiprazole to improve many of the symptoms of schizophrenia with a small risk of causing extrapyramidal adverse effects. Now I move towards third type, that is inverse agonist. Typically, unbound receptors are inactive and require interaction with an agonist to assume an active conformation. However, some receptors show a spontaneous conversion from inactive to active in the absence of agonist. These receptors thus show a constitutive activity that is a part of the baseline response measured in the absence of a drug. Inverse agonists, unlike full agonists, stabilize the inactive form. All of the constitutively active receptors are forced into the inactive state by the inverse agonist. This decreases the number of activated receptors to below that observed in the absence of drug. Thus, inverse agonists reverse the constitutive activity of receptors and exerts the opposite pharmacological effect of the receptor agonists. Now I move toward the antagonists and its type. What are antagonists? These are the drugs that decreases or opposes the actions of an other drug or endogenous ligand. An antagonist has no effect if an agonist is not present. Antagonism may occur in several ways. Many antagonists act on the identical receptor molecule or macromolecule as the agonist. Antagonists, however, have no intrinsic activity and therefore produce no effect by themselves. Although antagonists have no intrinsic activity, they are able to bind avidly to target receptors because they possess strong affinity. Now I move towards its type, that is competitive antagonist, irreversible antagonist, and functional and chemical antagonism. Okay, if both the antagonist and the agonist bind to the same site on the receptor, they are said to be competitive. The competitive antagonist will prevent an agonist from binding to its receptor and maintain the receptor in its inactive conformational state. For example, the antihypertensive drug terazosin competes with the endogenous ligand norepinephrine at alpha-1 adrenoceptors, thus decreasing vascular smooth muscle tone and reducing blood pressure. Now I move toward its second type, that is irreversible antagonist. An irreversible antagonist causes a downward shift of the maximum with no shift of the curve on the dose axis unless pair receptors are present. The effect of competitive antagonist can be overcome by adding more agonist. Irreversible antagonist, by contrast, cannot overcome by adding more agonist. Competitive antagonists increase the effective dose, whereas irreversible antagonists do not. There are two mechanisms by which an agent can act as a non competitive antagonist. The antagonist can bind covalently or with very high affinity to the active site of the receptor. This irreversibility in binding to the active site reduces the amount of the receptors available to the agonist. The agonist cannot outcompete the antagonist even if the dose increases. The second type of antagonist binds to a site, that is allosteric site, other than the agonist binding site. This allosteric antagonist prevents the receptor from being activated even when the agonist is attached to the active site. If the antagonist binds to a site other than where the agonist binds, the interaction is allosteric. There is a difference in the dose response curve of the agonist in the presence of a competitive versus non competitive antagonist. In the presence of a competitive antagonist, the maximal response of the agonist can be obtained by increasing the amount of the agonist administered. This results in an increase in the effective concentration value but maintenance of the agonist efficacy. In the presence of the non-competitive antagonist, a maximal response is not observed even with increasing the dose of the agonist. Thus, a fundamental difference between a competitive and non-competitive antagonist is that competitive antagonists reduce agonist potency, whereas non-competitive antagonists reduce agonist efficacy. Right? Now I move toward its third type, that is functional and chemical antagonism. An antagonist may act at a completely separate receptor, initiating effects that are functionally opposite those of the agonist. A classic example is the functional antagonism by epinephrine to histamine, introduced bronchoconstriction. Histamine binds to H1 histamine receptors on bronchial smooth muscle, causing contraction and narrowing of the bronchial tree. Epinephrine is an agonist at beta 2 adrenoreceptor on the bronchial smooth muscle, which causes the muscles to actively relax. This functional antagonism is also known as physiologic antagonism. A chemical antagonist prevents the action of an antagonist by modifying or sequestering the agonist so that it is incapable of binding to and activating its receptor. For example, protamine sulfate is a chemical antagonist for heparin, and it is a basic positively charged protein that binds to the acidic heparin, negatively charged, rapidly preventing its therapeutic as well as toxic effect. What should be noted that pharmacokinetic antagonist describes a situation in which antagonism effectively reduces the active drug concentration. This can occur when absorption of the drug is decreased or if the metabolism and renal excretion of the drug are increased. Here, these are three types of antagonists. Now I conclude my topic. For more information, like and subscribe my channel. Thank you.